Thank you for having me, Tim. Looking forward to this discussion.
Yeah, we're thrilled to have you on the show, and excited to learn more about you and what you're doing. So let's start. Let's just jump right in. Let's start with. Can you share a little bit about where you grew up and where you were raised, and then we'll just kind of walk through your career journey, and then we'll talk a little more about that.
I'm so proud to be a pharmacist, and so I really enjoy talking about this and my career path. So thanks for the chance to reflect on it with you. I grew up in the Midwest. I grew up in North Dakota and played volleyball at North Dakota State during my undergrad years and while I was taking pre-pharmacy classes, and then decided to move to Minnesota and go to the pharmacy school at the University of Minnesota to change things up a little bit because I had lived my entire life in North Dakota. But I decided that I wanted to go into pharmacy when I was a high school student. I was talking with my dad one day and was at that time in my high school career where everyone is asking you what you want to do when you grow up. And I didn't have a sophisticated answer. And he helped me reflect that upon the fact that I really enjoyed math, really enjoyed chemistry, and I wanted to help people. And I grew up in a family of all engineers and educators. And so I think he really was just looking for somebody to go into healthcare. But he had learned about the pharmacy profession and thought that that might be a good fit. And so I never looked back. And despite that, and being, fully committed from really when I was a junior in high school, I didn't have my aha moment about why I was glad to be in this profession until after I had graduated and had my first job. And my first job was with a medical device company in Minneapolis called Medtronic. They're well known for many things, but in particular, I worked with a group that was doing clinical research on pacemakers and defibrillators. And I reported to an engineer, and I overheard somebody ask him early in the days where I was hired for the role. Somebody asked him, "Well, why did you hire a pharmacist for this role?" I was working with engineers. I was going into the operating rooms and just learning all these new things. And I happened to overhear the question, and it wasn't an offensive question. It wasn't out of disrespect for me, but I was curious myself about why he had hired me. At the time, there were only 5 pharmacists working in the company that had about 30,000 employees at the time. It's much larger now. But I overheard his response, and it was, she went to a professional school. She learned how to learn. And that was probably the most empowering thing that a 26-year-old at the time could hear. And I think it's put me in positions and ever since then of uncertainty, where I've really had to dig in and learn. But it was all thanks to someone believing in that and helping to bring that clarity forward for me, as to the benefits of going to a professional program like the doctor of pharmacy program that I completed.
That's a great answer on why did you hire a pharmacist. That's a and I mean what a great thing to say about someone is that that you know how to learn and that you want to learn, and we definitely need more of that in the world. So that's a great response, and that had to feel good for you to hear that.
It was remarkable, and like I said, I really enjoy reflecting now, over 20 years back, on what a gift that was at the time. And I think most people would look at the career that I've been really fortunate to have as and label it as non-traditional. And I think we should move away from terms like traditional and non-traditional when we're talking about roles in healthcare, and instead embrace the diversity that the health professions can bring. And that we all went through a program where we learned things and we learned how to learn, and then that can be applied in all kinds of settings. And so when you look at the profession of pharmacy, for example, there's so many different practice settings that a pharmacist can work in. There's maybe the ones that were most visible in our communities, but there's so many other opportunities in the pharmacy profession that speaks to the breadth and the diversity of options. I think moving away from what's a traditional pharmacist is from a non-traditional pharmacist, or a traditional physician to a non-traditional physician, I think will help at least with the pipeline that we need for people to go and to continue to go into the healthcare profession and to want to become healthcare professionals.
I'm always intrigued on how people end up doing the role, or as you said, when you're a junior in high school, you decided that you wanted to, you thought maybe being a pharmacist was a good option for you. Um, when you grew up in North Dakota, I grew up in a small town in downstate Illinois, and the pharmacy was kind of at the center of the community. Did you see that where you grew up? Did you have a positive opinion of being a pharmacist by what you saw when you were a child?
I had some exposure to pharmacists in the community, and my some of my family members have lived in very small rural farming communities, and I understood the impact to that community when the pharmacist retired, and then there was no one to take that position, and then the pharmacy then transitioned into a telepharmacy, which was very innovative at the time to try to make sure that that care was still accessible to those patients. But it did take away that community resource, and I think that is one common recognition of pharmacists is that we are some of the most accessible resources in the communities. There's a statistics that we often quote that at least everyone in the country is 92% of those in our country are within 5 miles of a pharmacy. And I think we need to think about pharmacies as a healthcare access point. There's a lot more that happens there besides the dispensing of medications. There's the triaging of care. There's a screening for other conditions. It is an important community access point for sure.
Yeah, and I think to your point, I think there are a lot of communities around the country, like the one where I grew up, where you didn't have access to a hospital, and a lot of times, the pharmacist did much more than just give you your prescriptions. I mean, there was a lot of wisdom, and when that person took a 2 week vacation, the town was in trouble because a lot of people relied on the pharmacist for much more than just filling prescriptions.
Right. And that kind of comes back to our just even the earlier reflections on learning how to learn. The training and education of the doctor of pharmacy um, degree now is much higher than that of which states allow right now. And so there could be a lot more opportunities to support patient and public health if we are able to at the state level enable pharmacists to practice more of that standard of care consistent with their training and education. We've got a ways to go, but that's something that's a priority within our organization.
Well, let's talk a little bit about that. So you went to North Dakota State, and you played some volleyball, and then you went to the University of Minnesota. So can you kind of walk our listeners through how do you become a pharmacist?
Yeah, thanks for that question. Um, the actual program, the curriculum within the doctor of pharmacy program ranges anywhere from 3 to 4 years. Prior to that, the pre-pharmacy curriculum looks a little bit different for everybody, but there's requirements for completing coursework that may or may not include an undergraduate degree. We are seeing more and more students come in with an undergraduate degree. However, I did not have one. I completed the pre-pharmacy coursework. I took an exam and sent my applications out to the programs that I was most interested in. Once you're accepted into the program, then there's a set amount of didactic work, meaning in the classroom, and that's typically 3 years of work. And then you spend the fourth year or the last year doing experiential activities where are a year on rotations in different settings of care. And that completes your doctor of pharmacy program. There are some doctors of pharmacy program in the country that are 3 years, and it's much more tightened curriculum. And then many that graduate from the doctor of pharmacy program may go on to do a postgraduate residency program that may or could also be 1 to 2 years. And then that allows for them to get a little bit more skills ready to take care of patients either in a certain specialty area or with an administrative focus. I did not complete a residency after I graduated pharmacy school. I jumped right into the workforce, as I mentioned, but then 5 years into my career, I was very fortunate to complete a congressional health policy program where I was living in Washington, D.C., and then worked in the office of now late Senator Joe Lieberman. And the intention behind that program was to expose more pharmacists and develop that workforce of pharmacists that are interested in policy, but then also have those policymakers have a better understanding of what pharmacists can offer in terms of policy development and policy implementation.
How many, roughly, how many pharmacists are there in the U.S.?
That's a good question. There are just over 300,000 pharmacists, so we have less in our workforce than in comparison to medicine and nursing. And then we also include pharmacy technicians as valuable members of our healthcare team or our professional workforce. And there's over 400,000 pharmacy technicians, and they are really integral to our work, especially in some of those community settings and then in hospitals and health systems.
So, from a geographic standpoint, I'm just trying to give a picture with physicians. There are areas like outside of Atlanta where I live where, we have access to physicians. But as we said, in some of the rural communities, in some of the underserved communities around the country, there aren't as many physicians. In some areas, there aren't many physicians at all. Do you see that for pharmacists as well? Are they distributed? Is there a problem with geographic distribution of where those physicians or where the pharmacists are?
That's a good question, especially as we know they are predicting large shortages for physicians, especially in primary care. And then that does really call for empowering everyone in the community to be able to step in and provide that care if they're allowed to. We do see some of that. We see we see shortages in the more rural settings and more of a match to the supply and demand in more of those metro or urban settings, but not to the extent of the physician workforce. We are seeing less students apply into pharmacy school, which is really alarming, and that's why I'm really glad to be talking with you about this today, to reiterate that the pharmacy profession promises a lot of value and satisfaction. But we are seeing less and less a decline in those enrollments. And then that's having downstream effects in terms of seeing less pharmacy residents stepping into those roles as well. So it's something as a profession we're concerned about. Prior to the pandemic, we saw almost a match of supply and demand for pharmacists, thinking 2018, 2019 time frame, where there was almost a concern of an oversupply that we hadn't seen for a long time. And then the pandemic came, and that has really been very damaging to the pipeline for all healthcare fields. And the pharmacy profession took a similar hit.
Mm. I mean, going back to how we're raised in the lens that we look at the world through, I think when I was growing up, I thought of a pharmacist at the little shop on Main Street in my town. But it's really changed, hasn't it? With a lot of the retail, the larger retail, that's where I go to get my pharmacy or to get my prescriptions now. And there's a big change, isn't there, over the last 40 or 50 years?
That's true, and it is still so important that people go into those roles. I think it's requiring pharmacy students and pharmacy programs to help identify the environment in which they know that that person or that candidate will thrive. We need people in those settings of care. We need to create work conditions that draws people into those work conditions so patients can continue to access them. So it is really important. You're right. It's changed a lot, but that doesn't mean that we need it any less. We still need people in those roles. But there have been innovations that have allowed for medications to get to patients in another mode through mail order, for example, or some other mechanism. But that one-on-one interaction is still really important. Or the fact that pharmacists and pharmacy technicians provide immunizations. Now more and more pharmacists are providing point of care testing, so you could immediately rule out COVID-19 or influenza, things like that. Think it's time for us to think about how to evolve that care setting, to give patients what they need, and then also to provide that great space for pharmacists and pharmacy technicians to work in.
Absolutely. The pharmacist is such an integral part of the community, regardless of where they are. It's such an important part, and we're just a lot of times I think we just kind of take it for granted, but it's such an important job. So I mean, we have a lot of listeners that are in healthcare, but we have some that are not. So if they're driving while they're listening to this and they have a child sitting in the back, why should someone consider? You mentioned a little bit before you were good at math and chemistry and had a heart to serve others, but why should someone consider this field?
Well, thank you for acknowledging that we're integral. That means a lot to hear others say that. I've had the opportunity, I have a 14-year-old daughter and a 12-year-old son, and both of them have invited me to come and speak to their class on pharmacy, which is touching in its own because, that age, kids don't really like their parents being around much. Um, but I've had the chance to talk to middle school students about that and things that they should consider, to the point that we were just talking about. Only about a third of the pharmacists out there are working in sort of that traditional retail community pharmacy setting, just a third. And so that leaves 2/3 of enormous opportunity within that field where you can leverage things if you like math and science and you like taking care of patients and you like collaborating with people and if you like being on the cutting edge of innovation in healthcare. There's that gives a lot of different opportunities. And we do have workforce studies that are conducted every 5 years to take a pulse of that supply and demand to try to project the need that will be coming in the next 5 to 10 years. And from one of the more recent reports, and this is what I share with students, the most opportunity for pharmacists are in roles that have yet to be defined. And I think there's so much hope in that finding to show that there's medication use is so prevalent for managing so many acute and chronic conditions, and we're not getting it right. We're wasting billions of dollars on medications not being optimized. And so this report found that there's so much opportunity yet to be identified for the pharmacy profession to lean into to make sure that medications are optimized for patients. And I think that's the hope of it. And that's the part that I try to instill or convey to those that might be interested in entering our profession.
Well, I think it goes back to what you said when we started talking here. Just having, if you have a thirst for knowledge and you're curious and you want to continue learning, what a great profession to do that, and you can help people.
That's right. That's right. And I think with the innovation that we're seeing, for example, we were just at one of our meetings, we held a pharmacy futures meeting a couple of weeks ago in Portland, Oregon. And the focus of the summit was on artificial intelligence. And I think the big takeaway from all of that is that there are ways to leverage artificial intelligence so that the relational part of healthcare can come back into focus, both for patients and for healthcare providers that went into the field to have that high touch opportunity, that relational aspect to care delivery. I think there's really exciting ways for us to be disruptive and innovative to bring back the heart of that care delivery.
So let's talk a little bit about the organization that you work for, the American Society of Health-System Pharmacists. Can you share a little bit about your organization and what the mission is?
I'm happy to talk about ASHP. I've been grateful to be an employee there for about 8 years now. The American Society of Health-System Pharmacists, we are the collective voice of pharmacists, pharmacy technicians, and student pharmacists that, for the most part, work in hospital and health system care settings, but also work across the entire span and continuum of medication use. We represent 60,000 healthcare professionals who serve patients in those care settings with the vision that all medications, all patients will receive the right medications at the right time. And so it's an aspirational vision, but we are a mission driven organization. We are located in the Washington, D.C. area, and we were formed in 1942. So we've been around for a while. We just launched. I wanted to share. We just launched something called a "We're Your Pharmacist" campaign. You can find it just by searching ASHP and "We're Your Pharmacist." But this is going to be a multi-year campaign trying to raise awareness to the public, to spotlight hospital and health system pharmacists, and some of the things we've already talked about, to highlight pharmacists that work in oncology or emergency medicine and bring forward that medication specialist perspective onto these care teams. And so we launched it just recently, and it's exciting to see the kind of traction. And it's exciting to see our members feel so heard, because many many in the public don't even recognize that pharmacists are working in hospitals. So it'll be fun to watch the impact of that campaign over the years, and that hopefully it does help with that pipeline, building up the pipeline of those interested in the profession as well. We also have a subsidiary organization called the Pharmacy Technician Society that we just launched in November of 2023. And so far we have over 10,000 who have enrolled or joined that organization as their professional home. As I mentioned, the pharmacy technician workforce is really critical to patient care, critical to the partnership with the pharmacist. They bring in operational and technical expertise and efficiencies that really allow the pharmacist to focus on those clinical aspects of care, while the pharmacy technician brings in the technical expertise.
Well, I love that you all are doing that, and just increasing awareness around uh, how important pharmacists are to our overall healthcare. We started this podcast a few years ago during COVID, and the reason we started it was to put a big spotlight on what we called heroes of healthcare. And pharmacists are heroes. And I love that your organization and you are educating people around the importance of the profession that you represent and that you yourself have lived out. So that's incredible. And one of the questions I was going to ask you is I see that you host a podcast yourself. Can you share a little bit about that?
Sure. Our podcast, we have a Wellbeing Wednesday podcast, and it's part of the podcast that our organization provides overall. But the podcast that I mostly get to work on is part of a suite of resources that we have developed and advanced, informed by our members and on behalf of our members, to try to support the well-being of the workforce and mitigate occupational burnout. And so that's the real message behind the Wellbeing Wednesday podcast. And what we try to balance with those podcasts is recognizing that we need to support the individual well-being of pharmacists and pharmacy technicians in the workforce, but we really need to drive systems change. So what are some things that have been done, can be done, to work on those workplace environments or workplace conditions, mitigate those risk factors that are leading to occupational burnout in organizations, try to really bring the emphasis on the fact that occupational burnout is a systems problem, not an individual resilience problem.
Well, I know that you're aware of and involved with to some level with the Dr. Lorna Breen Heroes Foundation, which I'm a big fan of. And here at Jackson and Coker, we partner with Corey and Steph and their team. Um, and there's a big problem, obviously, with all healthcare workers with burnout, well-being. Do you see that with pharmacists as well?
Absolutely. Absolutely. We have, as early as the 1980s, we have an article that was published in our journal on hospital pharmacist burnout. Of course, we've learned a lot more since 1982, but this has been top of mind for our organization for some time. However, and this actually is probably one of my favorite stories about working at ASHP, is that our leadership recognized that it was becoming a more prevalent and pressing issue amongst the pharmacy workforce, occupational burnout. Around, after 2010 is really where our members started to be more vocal about it. And then in 2017, we revised our strategic plan, and we created professional policy related to well-being resilience. And once our organization does things like that, it creates a ripple effect. And watching the ripple effect since 2017, when we intentionally embedded a commitment to well-being and resilience in our strategic plan, has had such great impact. And it has allowed for us to be connected with great organizations like the Dr. Lorna Breen Foundation. And in fact, a little piece of the story is that, as I mentioned, our podcasts are just a part of the suite of resources and interventions that we're trying to put forward, because we recognize that occupational burnout is highly complex and it requires multiple solutions. One of the things that we worked on was to create a well-being and resilience professional certificate. We did a scan of the marketplace and realized that while there were a lot of resources available for bolstering your own individual well-being, there weren't a lot of professional certificates focused on systems change and creating change within organizations that would lead to cultures of well-being. And so we created a professional certificate. This was in spring of 2021. And at the same time, the Dr. Lorna Breen Healthcare Provider Protection Act inspired provisions that were included in the American Rescue Plan, which then appropriated funds to the Health Resources and Services Administration, or HRSA, to provide grants to organizations ready to help the healthcare workforce. And because we had this certificate, thanks to the collaboration years ahead of that, we were able to apply for and then received one of the HRSA training grants. So we launched something called the Wellbeing Ambassador Program, and we've so far enrolled over 4,000 members of the pharmacy workforce into that program, where they have access to our certificate, they have access to our coaches, and they have access to a learning community, to try to start to tackle the occupational burnout problem. But we are so grateful to the Dr. Lorna Breen Healthcare Provider Protection Act and to the foundation for that, and then for our ongoing collaboration since then.
Well, the work that you're doing is so important, and I think so often, and I'm guilty of this too. You show up at the pharmacy, or you show up at the hospital or the clinic, or wherever, and we just we don't understand, or I don't think of the people who are giving me care as a patient. Actually, they have they have a lot of stress in their jobs, and they have a lot going on, and we can't just expect our caregivers to be robots, and they have to take care of themselves so that they can take care of us. So I think it's so important that the work that you're doing around that.
Well, thank you for that. And our work is inspired by collaboration, like with the Dr. Lorna Breen Foundation, like the National Academy of Medicine Action Collaborative on Clinician Wellbeing and Resilience. Our work is guided by and better because of being able to collaborate on this big problem. And as you said, patients are, of course, impacted by it, which is why it's a patient care problem to begin with. And just as I said, the occupational burnout is a systems problem. Patients are also being hurt by the system. And because they can't even manage the system that they're being frustrated by, they tend to, you tend to take it out of the person in front of you, which oftentimes is a healthcare provider. So I think it just brings to light how important this issue is for patients and for the healthcare workforce.
Well, thank you for being a hero. As we wrap up here, I just want to thank you because I think you are a hero of healthcare. What your organization does, what pharmacists do, you're all heroes. And we have to take care of our caregivers because we're all patients at some point in our life. You know, we're patients. The caregivers are patients as well. So just very appreciative of you and what you and your organization are doing. So the final question that we ask of all of our guests on Heroes of Healthcare is, who is your hero?
I've appreciated the chance to reflect on this, and it was hard to narrow in to the one person, and I think that speaks to the blessing, the many blessings that I've been able to have both in my career, but then in my personal life. But I've decided that if I was to pick one, my hero would be my maternal grandmother. She has since passed, but growing up, she was always very positive. She was such a positive woman, and there were times I think that I saw it as sort of being simple-minded, that she could be so positive. And now as an adult, I see what a difficult choice she made to always be positive, to be warm, to be compassionate, to be resilient. This is a woman who had to drop out when she was in the 8th grade from high school to care for her mother who had breast cancer. She waited for 3 years to marry her husband, who was in World War II. She never got her driver's license. She never finished high school. She tragically lost her husband, my maternal grandfather, at the age of 50, which was very young. My mom was only 26 at the time. And the night that it happened, he was a superintendent at a high school, and he was running around the gym to get some exercise, and then shortly after there suffered a fatal heart attack. And that night, my mom and my mom's sister drove home, and the minute they walked in the door, they met my grandma, and my grandma said, "Girls, I'm going to get my driver's license, and I'm going to move to Grand Forks, North Dakota, and I'm going to work at JCPenney's." And that embodies that resilient spirit she had. She knew she needed to have a plan. And as I said, the more I reflect on my grandma, the more resilient of a person she was. And I try to, those have now become my values, to try to be warm and compassionate. But I'm falling very, very short in contrast to how she lived her life. But at least I had a very good role model for it.
Well, you did, and she's definitely a hero, and I'm sure she would be very proud of her granddaughter and the impact that you're making on many lives. So, thank you for joining our show today. Thank you for helping us increase awareness of the role of a pharmacist, and also sharing a little bit of your background. We're very appreciative of your time, and thank you for joining us.
Thank you so much for the platform so that we could spotlight the pharmacy profession. I'm very grateful for that.